people who find themselves in these streets.
Resuming debate, the honourable member for Vancouver Quadra.
Thank you, Mr. Speaker, and I will be sharing my time with the member from Parkdale High Park. Today I'm very proud to stand in this House in support of C-14, introduced by the Honourable Minister of Justice. With this bill, our government recognizes the autonomy that Canadians hold over their own lives, the expertise of our medical professionals, and the decision of the Supreme Court of Canada. And through extensive consultation, we have introduced a balanced solution that will restore dignity, protect the vulnerable, and allow our nation's medical professionals to respect the wishes of their patients. Until now, Canadians faced horribly debilitating end-of-life suffering and had no legal control over their own lives. In desperation, some have gone to court to regain this control, a difficult process which compounded the physical and emotional strain felt by the patients and their families. Doctors, nurses, and family members alike have felt powerless to assist those they care for, with no legal means to honour the wishes of those who suffer, as I mentioned. They face emotional strain and difficult moral dilemmas as the law prohibits them from respecting their patients' dignity and doing what they often know is the compassionate medical assistance for a good death. And, Mr. Speaker, many of us in this chamber and across the country have personal stories of the kind of suffering I mentioned. And I do as well. I have an indelible memory of visiting in the hospital a dear friend of many decades whose body was breaking down from a terminal illness, who was in excruciating pain for weeks and eventually declared he would not eat or take water or liquids. And after 6 days of even more miserable suffering, he finally passed away. So we are here to talk about a bill setting out a new form of medical service in Canada, and that's medical assistance in dying. With this bill, we recognize that decisions over one's person, including the decision to end one's life with dignity, should ultimately rest with the individual and not with the government. Through consultation and careful consideration, Bill C-14 includes the following safeguards: a requirement for a second independent medical opinion, a requirement, a 15-day reflection period, the ability for a patient to withdraw consent at any time, and rigorous requirements for documentation at every step with new criminal offences to prevent any potential abuse. This government recognizes the need to respect the moral conscience of individual medical professionals. While every patient who fits the medical criteria will have access to medically assisted dying, no individual doctor or nurse will be required to participate if it conflicts with his or her values and beliefs.
Some providers have said that they are reluctant to refer people who are seeking medically assisted dying to another practitioner when they are worried that this might make them complicit in someone's death.
Critical to reflect important safeguards, we must also respect that people seeking this procedure should have reasonable access. In Carter, the Supreme Court of Canada recognized that the conscience rights of physicians will need to be reconciled with the charter rights of patients seeking medical assistance in dying. Although much of the necessary balancing will be a matter for the provinces and territories, our government is committed to working collaboratively with provinces and territories to support access to medical assistance in dying while respecting the personal convictions of healthcare providers. The federal government will offer support to help ensure that all Canadians have access to the medical aid they need. One approach is a pan-Canadian coordination system for access to medical aid in dying. And we can start by reviewing the assisted dying regimes in other countries to see what they have done and assessing their applicability to Canada. Plus près de nous, au Québec.
Closer to home in Quebec, the end-of-life care legislation offers other examples. It includes a range of end-of-life care. For example, palliative care, palliative sedation, and medically assisted dying. This legislation makes the service widely accessible in establishments and at home.
Not required to provide this option, but they are required to notify the institution or local authority of any request and forward the patient's request form. The institution will then take the necessary steps to find, as soon as possible, another physician to address the request. Many people of Vancouver Quadra who have contacted me about this bill have expressed to me their support for medical assistance in dying. As their representative, I am pleased to support the work of my colleagues, the Minister of Health and the Minister of Justice. Under this proposed legislation, medical assistance in dying would be available only to mentally competent adults who are eligible for publicly funded health services in Canada, have an incurable illness, disease, or disability, are suffering intolerably, and are in an advanced state of irreversible decline in capability, and whose death is reasonably foreseeable. Some of my concerns have also expressed concerns about access. Nos critères permettent à certaines personnes.
Our criteria allow certain people, but not everyone, who asks for it, to have access to medical aid in dying. Certain Canadians and experts have said that they are concerned about the possibility of broadening the criteria to mature minors with regard to advance consent and to include mental illnesses.
Canadians know that our government has heard their concerns. Pour le moment, la quantité limitée de renseignements. For now, the limited amount of information on this topic calls for a prudent approach, as you will see in the draft of the bill before you. However, the government has committed to undertaking independent studies in order to better understand the risks associated with this issue. The findings of these reports will contribute to the 5-year legislative review provided for in the bill. Other facets of the challenge of access. As we all know, our country has many remote and rural communities that face challenges in accessing healthcare services, including access to a physician or other healthcare provider. Although delivery of healthcare is a provincial and territorial responsibility, accessibility is one of the 5 main principles of the Canada Health Act. I am delighted to point out that in addition to protecting vulnerable segments of the population, we have considered matters around access, and we have dealt with this throughout the bill and as part of complementary projects. The umbrella term medical assistance in dying encompasses both the situation where a provider must be physically present to administer a substance that causes death, and the situation where the provider prescribes a medication that the person can take him or herself. Having criminal exemptions for both procedures will help to increase access for eligible people and provide choices in the circumstances around which medical assistance in dying is provided. Secondly, the draft legislation provides exemptions for both physicians and nurse practitioners to be able to provide this assistance. Nurse practitioners, or those with an equivalent designation, are authorized in many provinces to perform medical functions necessary for medical assistance in dying. Exclure les infirmières praticiens de la Excluding nurse practitioners from criminal liability would give provinces and territories other options to facilitate access to medical assistance in dying in underserved regions. Of how we're working to support access in our healthcare system. Canadians, experts, and stakeholders have focused on the need to improve access to quality palliative care in Canada, even as we consider how to implement medical assistance in dying. And we have listened. Our government is making the commitment to develop, along with the provinces and territories, measures to support the improvement of a full range of end-of-life care, including palliative care. Dans le contexte d'un nouvel accord sur la... In the context of a new health accord, our government pledged to invest $3 billion over 4 years to improve home care, including palliative care. Discussions with the provinces and territories are already underway. essential that we end the suffering and restore the dignity of Canadians currently experiencing grievous and irremediable medical conditions as soon as possible. The draft legislation before us acknowledges the need for access alongside the need for safeguards and protections. With this bill, our government will achieve these objectives and meet the deadlines imposed by the Supreme Court of Canada. I have confidence we can put in place a system that meets the needs of Canadians for compassionate care and support at the end of life. I invite my colleagues in this House and all Canadians to contribute their views to this discussion as we continue the process of updating our laws to reflect 21st century realities. Our door is open, our government is listening, and we are committed to support our medical professionals, protect our most vulnerable, and restore the dignity of Canadians in their most trying moments. Thank you, Mr. Speaker.
Questions and